So now coming to the body of the pancreas. The body of the pancreas is extending from the neck of the pancreas to the tail of the pancreas. It is just in the transpyloric plane, okay, and it is declining backward and slightly upward. So upward, backward, it is directed. Body has three borders: the superior border, the anterior border, and the inferior border, and three surfaces: the anterior surface, the inferior surface, and there is a posterior surface. So from the superior border there is a tuberomentally, there is a process which is known as tuberomentally, where the above which the celiac artery or the celiac trunk divides into splenic artery, hepatic artery proper, and the left gastric artery. So from here, that is the superior border is related. Now coming to the inferior border, the anterior border. So anterior border is related to the transverse mesocolon. Anterior border is related to the transverse mesocolon, attachment of the transverse mesocolon. Inferior border is related to the superior mesenteric vessels. Now the anterior surface is related to the lesser sac of the and the stomach. So anterior surface, there is a lesser sac and the stomach. Posterior surface is devoid of peritoneum. It has aorta, splenic vein, the left kidney and left suprarenal gland, all are in the posterior surface. And the inferior surface is related to the duodenojejunal flexure. So it is in the inferior surface. Inferior surface is related to the duodenojejunal flexure. These are related to the posterior surface, and this is related to the anterior surface. Anterior surface. So this is all about the body, the relations of the body. The coils of the jejunum and also the left colic flexures are also related to the inferior surface. So duodenojejunal flexure, coils of the jejunum, and the left colic flexure all are related to the inferior surface. Now coming to the tail of the pancreas. Tail of the pancreas enters the hilum of the spleen. It has a renorenal ligament which is attached to the splenic vessels, where the splenic vessels lie. It has maximum islet of Langerhans. So in the splenectomy we have to be sure that the tail of the pancreas is not cut, so it should be conserved. Between gastric and the colic impression of the spleen, there lies the tail of the pancreas. Now coming to the duct of the pancreas. So there are two ducts: main pancreatic duct, which is known as duct of Wirsung, and accessory pancreatic duct, that is the duct of Santorini. It is just like the duct of Wirsung is just like a herringbone pattern. Okay. So it arises from the tail of the pancreas and traverses the whole length of the gland, and at the neck of the pancreas it turns downward and right and enter to the second part of the duodenum at the major duodenal papilla. Major duodenal papilla is located 10 cm from the pylorus, and there is a hepatopancreatic ampulla or ampulla of Vater is also present here. Hepatopancreatic ampulla or ampulla of Vater, it is present here. Okay, it is a herringbone pattern. So 90% of the maximum secretions are from this pancreatic duct, main pancreatic duct or duct of Wirsung. Accessory pancreatic duct or duct of Santorini, it is upward medially and crosses the main pancreatic duct. Okay, it opens into the minor duodenal papillae just 2 to 3 cm above, that is, it is 2 cm. So 2 to 3 cm above the major duodenal papilla, or 8 cm from the pylorus. So it mainly secretes, takes the secretion from the head and the uncinate process. Okay. So this is all about the anatomy of the general anatomy of the pancreas. Thank you.